The different types of diabetes, a complete guide. Diabetes is one of the most common chronic diseases in the world. But did you know that there are different types of diabetes? While many people are familiar with type 1 and type 2 diabetes, there are actually several forms of the disease, each with unique causes, symptoms, and treatment approaches. In this video, we will explore the different types of diabetes, how they develop, their symptoms, and what can be done to manage them. Whether you or someone you know has diabetes, understanding its types is essential for better health and prevention. What is diabetes? Before we dive into the types of diabetes, let's first understand what diabetes is and how it affects the body. Diabetes is a condition where the body struggles to regulate blood sugar or glucose. Normally, when we eat, our body breaks down food into glucose, which is used for energy. Insulin, a hormone produced by the pancreas, helps transport glucose from the blood into the cells. But in diabetes, this process doesn't work properly. Either the body doesn't produce enough insulin, or the cells stop responding to it, leading to high blood sugar levels. Over time, this can cause serious health complications. Now let's look at the different types of diabetes. Type 1 diabetes. Type 1 diabetes is an autoimmune condition, meaning the body's immune system mistakenly attacks and destroys insulin-producing cells in the pancreas. As a result, people with type 1 diabetes produce little to no insulin. This type of diabetes usually develops in childhood or early adulthood, which is why it was once called juvenile diabetes. However, it can occur at any age. Symptoms of type 1 diabetes include extreme thirst and frequent urination, sudden weight loss, fatigue and weakness, blurred vision, increased hunger, and slow healing wounds. Because people with type 1 diabetes cannot produce insulin, they must take insulin injections or use an insulin pump for life. There is no cure, but careful management with diet, exercise, and insulin therapy helps keep blood sugar levels under control. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes, accounting for about 90% of all cases. Unlike type 1, the pancreas still produces insulin, but the body's cells become resistant to it. Over time, insulin production may decrease, making it harder to control blood sugar levels. Type 2 diabetes is often linked to lifestyle factors such as poor diet, lack of exercise, and obesity. However, genetics can also play a role. Symptoms of type 2 diabetes include frequent thirst and urination, fatigue and low energy, blurry vision, slow healing cuts and infections, and numbness or tingling in the hands and feet. Many people with type 2 diabetes don't realize they have it because symptoms develop gradually. This is why regular blood sugar testing is important, especially for those at risk. Managing type 2 diabetes involves eating a balanced, low-sugar diet, engaging in regular physical activity, maintaining a healthy weight, monitoring blood sugar levels, and taking prescribed medications or insulin if needed. Some people with type 2 diabetes can manage their condition through lifestyle changes alone, while others may require medication. In some cases, type 2 diabetes can even go into remission with the right approach. Gestational diabetes. Gestational diabetes occurs during pregnancy when hormonal changes cause insulin resistance. This means the body cannot use insulin properly, leading to high blood sugar levels. Unlike other types of diabetes, gestational diabetes usually disappears after childbirth. However, women who develop it have a higher risk of developing type 2 diabetes later in life. Symptoms of gestational diabetes include increased thirst, frequent urination, fatigue, and blurred vision. Many women with gestational diabetes don't experience noticeable symptoms, which is why glucose screening tests are a routine part of prenatal care. Managing gestational diabetes involves following a doctor-recommended diet, engaging in moderate exercise, monitoring blood sugar levels, and in some cases, taking insulin or medication. With proper management, most women with gestational diabetes have healthy pregnancies and deliver healthy babies. Prediabetes. Prediabetes is a warning sign that blood sugar levels are higher than normal, but not high enough to be classified as diabetes. People with prediabetes have a higher risk of developing type 2 diabetes if they don't take action. Symptoms of prediabetes often do not appear. However, some people may experience fatigue or dark patches on the skin, especially around the neck and armpits. Because prediabetes doesn't always have noticeable symptoms, many people don't realize they have it until it progresses to type 2 diabetes. Preventing prediabetes from becoming diabetes involves eating a balanced diet with less sugar and processed foods, exercising regularly, maintaining a healthy weight, and reducing stress while improving sleep habits. The good news is that prediabetes can be reversed with healthy lifestyle changes. Other rare types of diabetes. There are also less common types of diabetes that are worth mentioning. MODY, or maturity onset diabetes of the young, is a rare form of diabetes caused by genetic mutations. It usually develops in teenagers or young adults, but is often misdiagnosed as type 1 or type 2 diabetes. LADA, or latent autoimmune diabetes in adults, is sometimes called type 1.5 diabetes. LADA is an autoimmune condition like type 1, but it develops later in adulthood and progresses more slowly. Cystic fibrosis-related diabetes occurs in people with cystic fibrosis due to the thick mucus affecting their pancreas, reducing insulin production. Steroid-induced diabetes can develop due to long-term use of steroid medications, leading to high blood sugar levels that may be temporary or permanent. These rare types require specialized testing and treatment. Final thoughts. As we've seen, diabetes is not a one-size-fits-all condition. There are different types, each with its own causes, symptoms, and treatments. Understanding the different types of diabetes can help people take the right steps for prevention, early detection, and effective management. If you found this video helpful, don't forget to like and subscribe for more health-related content. Do you or someone you know have diabetes? Share your experiences in the comments below.